Hello everybody, in this video lecture we will cover chapter 14, autonomic nervous system. Let's go ahead and begin. Okay, so ANS, it consists of motor neurons because autonomic nervous system, it's a motor division, right? So that's why it consists of motor neurons. And those motor neurons, they innervate smooth muscles, cardiac muscles, and glands, right? When we have somatic motor system, now somatic motor system innervates your skeletal muscles, right? Somatic motor system are under voluntary control. This is under involuntary control. So let's see how I can show small. Okay. I just, I want to still have my picture, but well, I guess it's fine. It's fine if your name is here, Kimberly, right?
Sorry, yeah, thank you.
Yeah, that's, I mean, it's okay. We don't see you, we just see your name. Okay, now autonomic nervous system makes adjustment to ensure optimal support for body activities, and it's operate via subconscious control, right? So innervates smooth cardiac muscles, glands, and it's involuntary, and it's also adjust your movements. Okay, now other names: involuntary nervous system, general visceral motor system, but doesn't matter how you look at it, you see that peripheral nervous system, we already covered it before. It's divided into sensory or efferent division and motor or efferent division. And this motor efferent division, this is where you will find your ANS, autonomic nervous system, along with somatic nervous system. And you see how this motor division, how it takes information from center system to the periphery to your effector organs, your muscles and your glands. And autonomic nervous system then divided into sympathetic division and parasympathetic division. Now, how somatic and autonomic motor nervous system are different? They differ in effectors, in efferent pathway, right? And they're neurotransmitters, and efferent pathways are from central nervous system to effector organs, and target organ responses to neurotransmitters. Now we will look at all these differences in more details. So effectors, we already said that somatic nervous system effectors are skeletal muscles. In autonomic nervous system, effectors are cardiac muscles, smooth muscles, and glands. So this is how they differ. Now efferent pathway. Now in somatic nervous system, we have one motor neuron, and this motor neuron is heavily myelinated. So axons of those neurons are myelinated. So only one motor neuron from central nervous system to muscle. In ANS, we have two neuron chain. We have preganglionic neuron, and it starts in the central nervous system. And it has thin, lightly myelinated preganglionic axon. And ganglionic neuron that is unmyelinated, right? And this is the one that, well, axon is postganglionic axon, unmyelinated, and it's extend to the effector organ. So we have preganglionic neuron, we have ganglionic neuron, we have preganglionic axon, and we have postganglionic axon of ganglionic neuron, right? That's a lot of stuff. But if you look at the picture, let's look over here, and then we get back. So here's our somatic nervous system, right? Imagine this beige color, that's your central nervous system, right? So central nervous system, spinal cord. So one neuron heavily myelinated, right, all the way to the skeletal muscles. In autonomic nervous system, you see we have these neurons, right, one, and here we have two. Well, this one kind of, this is different because it's innervate adrenal medulla, and adrenal medulla is actually neural system. So we do have neurons inside this medulla. So you can just kind of ignore this for a second, but look, one neuron, second neuron, one neuron, second neuron. So this neuron, this one and this, is called preganglionic neuron. Now this neuron is called ganglionic neuron. Now this axon, called preganglionic axon, and this axon is called postganglionic axon. Right, so we have two motor neurons in ANS. That's how they're different, and only one in somatic nervous system. And the last difference is neurotransmitter effect. In somatic nervous system, all somatic motor neurons release acetylcholine, and effects are always stimulatory. So they always stimulate target organ. In autonomic nervous system, preganglionic fibers also release acetylcholine, but postganglionic fibers can release acetylcholine or norepinephrine. An effect can be either stimulatory or inhibitory, right? So that's the last difference. So again, we just said over here, oops, here's our differences, right? In effectors, efferent pathway, and their neurotransmitters, and target organ responses to neurotransmitters, right? So different effectors, different efferent pathway, one neuron or two neurons, and neurotransmitter effects, right? And here's the picture for summary. Also, we said that autonomic nervous system has two divisions, sympathetic and parasympathetic. However, almost all visceral organs are served by both divisions. So they have what we call dual innervation, right? So let's say your, I don't know, your stomach, your heart, your I don't know, kidneys, right? So they mostly innervated by both divisions, but they have opposite effect. Your lungs. Now, role of the sympathetic division. What is sympathetic division? Well, this is mnemonic, how to remember it. Sympathetic means you need sympathy, and you need sympathy when you're under stress, right? So this is the division that mobilize your body during either activity, during your exercises, or during some stress, when you threatened. So it's called fight or flight system. Now, when you are exercising, or when you threatened, right, or you're scared, right, you under stress, then where do you think you need your blood to flow? Or it's fight or flight system. So you see like a big, bear coming towards you. You need to run away, right? That's when you're threatened. Or when you're doing exercises, you need blood to flow to your skeletal muscles and to your heart, right? So your heart rate increases, your skeletal muscles contract during exercises or when you run away, right, to save your life. Now, bronchioles need to be what? Constricted or dilated? Of course, they need to be dilated so you can get more oxygen into your lungs. And you need glucose in your blood, right? So liver releases glucose. So that's what's gonna happen when you exercising or under stress, and then your activity are regulated by sympathetic division of ANS. Now, when is your parasympathetic division active? Well, this division is called rest and digest. So actually it promotes maintenance activities, like keeping your balance, or when you're sitting, right, keeping, you're straight. So something that just maintain your activity, and it conserves body energy. So it's activated in a person who is relaxed, reading, or after a meal. That's why we call it rest and digest. Now, during rest and digest, what do you want your blood pressure? Increase or decrease? Of course, you want your blood pressure go down, your heart rate decrease, respiratory rates slow, right? So that all will be regulated by your parasympathetic system. Now, when you're resting and digesting, then gastrointestinal tract activity needs to be high. Now, what happens with your pupils? Pupils are constricted when you are resting because you don't need a lot of light you need to see what is, usually danger comes from, oh, my connection is unstable. I hope I'm good. So usually danger comes from distance. So when sympathetic nervous system activates your pupils, then they will be accommodated for far vision. During the rest, it's close vision and pupils are constricted. Okay, so now over here, we can see our two divisions, sympathetic, parasympathetic. Now, this is peripheral nervous system, right? This is peripheral nervous system. Peripheral nervous system includes nerves, cranial nerves and spinal nerves, right? So nerves originate in the spinal cord. But for these two different divisions, those fibers or nerves or fibers, they originate in a different region of spinal cord. For sympathetic, look, origin of fibers, that means origin of axons or neurons, thoracolumbar region. So in the thoracic region and in lumbar region of the spinal cord. And in the parasympathetic division, fibers will originate in the brain and sacral spinal cord. So this is called craniosacral division, and this is called thoracolumbar division. Now, length of the fibers also different. In sympathetic, remember, in both divisions, we have two motor neurons, preganglionic and postganglionic. All right, so in sympathetic, preganglionic is short and postganglionic is long. In parasympathetic, preganglionic is long and postganglionic is short. Right now, location of the ganglia, we will look at it, where it's located in a second. So here, let's look at this diagram. So here's your brain and spinal cord, right? And of course, your spinal cord is divided into segments. And what are those in your brain? Those are nerves, cranial nerves, right? So if you look at this green stuff, this is the origin of the sympathetic division, thoracolumbar, T1, L2. So in this region, so that's where we have, and you see how we have one neuron shown in dark green and the second in the light green, right? Because we do have always two motor neurons in autonomic nervous system. And this is called preganglionic and this is postganglionic. So preganglionic is short and postganglionic are long. When you look at parasympathetic, right? So you see over here, this is our preganglionic long and postganglionic short. And it's the origin is a brain stem, right? Or sacral region. Okay, so sympathetic thoracolumbar division. So sympathetic division is called thoracolumbar. Preganglionic neurons are in the spinal cord segments T1, L2, right? So where they are? Right there, T1, L2. Those are our preganglionic neurons. Sympathetic neurons produce the lateral horn. So those lateral horns, this is where you find these preganglionic neurons. Preganglionic fibers pass through the white rami communicants and enter sympathetic trunk that is called paravertebral ganglia, or chain ganglia. So let's look over here. So this is spinal cord, right? This is our ventral gray horn, right? This is dorsal or anterior and posterior. Now this is somatic motor neuron. Somatic motor neuron innervates your skeletal muscle, right? So it's shown over here. It's originate in the ventral gray horn, right? This is ventral gray horn. And it's leaving your spinal cord through the ventral root or anterior root, right? And it's form nerve, and it goes innervate your skeletal muscle. Now, that's somatic. Autonomic nervous system, the neuron originate in a lateral gray horn, right? So that's a lateral gray horn. This is ventral, this is lateral. Now, it also leaves a spinal cord through the this root, ventral root, but it doesn't go straight to the organs. It's actually kind of like makes this U-turn, right? You see over here, and it enters this ganglia, right? And this ganglia has several names, right? It's called chain ganglia, or it's called over here paravertebral ganglia, or sympathetic trunk ganglia. So I don't know why they have so many names for the same stuff. You can just call it chain ganglia, right? But you need to know all three names if you see it on your test. So this neuron, and this is preganglionic because that's our ganglia. So it's before. So it's preganglionic neuron. It enters this ganglia through this area that is called white ramus communicants. Now, then something can happen. Now this neuron can synapse. You see this way, it's synapsing with the ganglionic neuron. And then ganglionic neuron has postganglionic axon, and it's exit this ganglia through gray ramus communicants, right? And then it's innervate effector organs. Or it can go up or down, or it can leave this chain ganglia without synapsing, but then it will synapse in another ganglion that is called collateral ganglion. So because we always have two motor neurons, right? Because we have two motor neurons, they need to synapse with each other, right? So we have one motor neuron, another motor neuron, so they do need to synapse, form this chemical synapse. So where are they gonna synapse? Well, they can synapse in a chain ganglia, right? Or they can synapse in a collateral ganglia, right? If one or another. So, but they will synapse somewhere because. Okay, now, how many of these ganglia do we have? We have 23 paravertebral ganglia in a sympathetic trunk or chain, right? Paravertebral means it's close to the vertebral column, paravertebral. So 3 cervical, 11 thoracic, 4 lumbar, 4 sacral, and 1 coccygeal. And look, we do have 3 cervical, but if I go back over here, we're talking about sympathetic nervous system right now. You see how sympathetic motor neuron, how they originate only from T1. We do not find them in the cervical area. However, we do have 3 cervical ganglia. That means that this neuron can go up and synapses in a cervical region with the postganglionic neuron. Right, so don't make it confuse you, right? Even if we in T1, L1, we still have cervical ganglia, so neurons actually can go up. And this ganglia is for synapse. Because you guys remember what ganglia is. Ganglia is collection of cell bodies. Because, you know, we have lots of cell bodies that our preganglionic neuron gonna synapse with, it's forming the ganglia. Right, so here's our paravertebral ganglia. Now, when your preganglionic neuron enters that ganglia, one of the following can happen. It can synapse, it can ascend or descend, or it can pass through. Right, so let's look over here. So we're just looking at each example. So spinal cord, you see lateral gray horn. So that's the origin of preganglionic neuron. So it's shown here in darker green. So that's our first motor neuron. So it's actually, goes to the ganglia, right? So this is our sympathetic trunk ganglion or chain ganglia. And it can synapse right there, right? So it synapses with this light green color neuron. So this is the one thing that can happen. And if that happen, then this neuron gonna innervate your erector pili muscles to erect this hair in your skin. It's gonna innervate the sweat glands in the skin, or it's gonna innervate blood vessels of the skin, right? So if they synapse in a chain ganglia, then those neurons innervate this structure. So I think it will be, yeah, so right here. So pathway with synapses in the chain ganglia. So if they synapse in the chain ganglia, they will innervate sweat glands, erector pili muscles, and vascular smooth muscle of blood vessels, right? That makes sense? So that what can happen with this preganglionic neuron. What else can happen? Well, you see, it can enter a chain ganglia, but you see it didn't synapse over here, no synapses. So it can go up 1 or 2 ganglia, or it can go down. And then it will synapse in a ganglia above or ganglia below, right? And then it leaves the ganglia, and it's also going to activate pretty much the same stuff. Sweat glands, erector pili muscles, and blood vessels, smooth muscle of blood vessels in your cutaneous blood vessels, right? What else can happen? Well, it can enter the chain ganglia, and that's it. It's not going up, it's not going down, it's not synapsing here, it's just leaving through. And then it still needs to synapse somewhere. Then it will synapse in a ganglia that's called collateral ganglia. And when this happens, when neuron just goes through the chain ganglia and just leaves it, it leaves through the structure that's called splanchnic nerve. Right, so splanchnic nerve, when our preganglionic neuron just passes through the chain ganglia and moves to collateral ganglia, then synapses with postganglionic neuron. And then it will innervate target organs in the abdomen, right? For example, intestine, right? So that's 3 things that can happen. Now, also very quickly, that this, let's see, you see this pathway over here for preganglionic neurons, this is called white ramus communicans. Now it's called white ramus. Well, ramus means branch, so it does look like branch. Why we call it white? Because this neuron, preganglionic neuron, it's myelinated. It's slightly myelinated, but it's still myelinated. And because it has this myelin sheath, it appears white. Myelin sheath, this fat, it looks white. So that's why we call it white ramus communicans. Now, after synapsing, this postganglionic neuron, it's gonna leave this chain ganglia through this structure that's called gray ramus communicans. And it's called gray because postganglionic neuron is not myelinated. And when it's not myelinated, it appears gray. That's where those names came from. Okay, so now what we just said. So if preganglionic and postganglionic synapse in a chain ganglia, that they will innervate sweat glands, erector pili muscles, vascular smooth muscles in blood vessels. Now, some of these fibers from T1 to T4, they will go up, and then they will synapse in a chain ganglion, but in a cervical ganglion, and specifically in a superior, because we have 3 of them. So let's go back. and I show you. So you see how we have, here's our T1 and how we have 1, 2, 3. So we have superior cervical ganglion, middle, and inferior. So we have 3 ganglia in the cervical region. So the ones that coming from T1, T4, right, some of the fibers can go up to the superior cervical ganglion. And when that happens, right, they innervate skin and blood vessels of the head. So the same stuff, right, erector pili, sweat glands, and the blood vessels of the skin, but skin of the head. But plus to that, they can stimulate dilator muscle of the iris, right? Because we do need to dilate, because we need to what? We need to dilate the iris. This is sympathetic division, so we under stress. And it will inhibit nasal and salivary glands. We don't need mucus. We don't need, lots of saliva, because we're not digesting stuff, right, when we under stress. And if you have a lot of mucus, it will restrict airflow to the lungs, and we need as much air as possible when we under stress, right, and when we threaten for our life. So these fibers, plus doing what they're supposed to do, they also stimulate dilator muscles and inhibit nasal and salivary glands. Now, other preganglionic fibers from T1, T6, right? They, they can go up to the cervical region, but they will synapse into, let's say, middle or inferior cervical ganglia, right? Not superior, but middle or inferior. Then what they gonna innervate? They're gonna form cardiac plexus, and they're gonna innervate the heart. They're gonna innervate thyroid gland and the skin of the neck, and they're gonna innervate lungs and esophagus. So those goes up still, but not to superior cervical ganglia, but to the inferior and middle, right? So those are, oh, by the way, here's a picture. So let's see. So you see how some fibers synapse in this chain ganglia. Some go to the superior cervical ganglion, and here's their innervation. Some go to the middle or inferior, and they form these cardiac plexuses, and they innervate heart and lungs. Heart, lungs, and esophagus as well. And of course, skin, because they always innervate skin if they synapse in any of these chain ganglia, right? Okay, now, what happened with fibers from T5 to L2? Most of them synapse in the collateral ganglia. That means they're gonna just go through this chain ganglia. And when that happens, remember, they forming splanchnic nerves. They form thoracic, lumbar, and sacral splanchnic nerves. And their ganglia, this collateral ganglia, right, include celiac. You guys probably don't know where celiac, what? I don't know, yeah. Well, okay, so we have celiac trunk, right? That's a blood vessel, right? Just right below the diaphragm from the surrounding, well, kind of like located around that blood vessel. Celiac trunk is a blood vessel. Superior and inferior mesenteric are also blood vessels. Superior mesenteric artery and inferior mesenteric artery. So those collateral ganglia are gonna be just close to these blood vessels. That's the name came from. Okay, so what is this? Okay, so now the one that, let's look at the picture over here. So over here, you can see how these fibers, right, how they're not synapsing, but they passing through this chain ganglia, and they synapse actually in collateral ganglia. So they can either synapses into the superior mesenteric, inferior mesenteric, and celiac ganglion over here, right? So now when this happens, this is called splanchnic nerve, right? So they leave the chain ganglia as a splenic nerve, or it calls sometimes visceral nerves. Right, so greater splenic nerve, lesser splenic nerve, lumbar splenic nerve, and they innervate viscera of the abdomen, right? So that's what it says over here. Fibers from T5 to L2 travel through the thoracic splenic nerves, synapses in the celiac and superior mesenteric ganglia, and they innervate stomach, intestine, liver, spleen, kidneys. Now we're moving down from T10 to L2. They travel through lumbar and sacral splenic nerve, and they synapse in inferior mesenteric ganglia, and they innervate the distal half of large intestine, urinary bladder, reproductive organ. You don't really need to memorize these numbers, but just in the general, right, you need to know that on the top, right, close to T1, T4, they go up, then T1, T6, they can form this cardiac plexus, and then we move down the spinal cord, right? Many of these fibers, they live as a splenic nerve, they synapse in the collateral ganglia and innervate visceral organs. But it doesn't mean they don't synapse over here. So, because we have so many fibers, some will synapse in this ganglia and innervate, you know, your skin, but some will innervate internal organs. Yeah, you know, nervous system is not easy. It's so complicated that, and it's not fully understood yet. So this is very simple representation of how all these fibers actually travel. It's way more complex than that, because some will synapse in the same chain ganglia, some still will go up and down, some will go through. Okay. Now, some preganglionic fibers will pass directly to adrenal medulla without synapsing. Upon stimulation, medullary cells will secrete norepinephrine and epinephrine into the blood. Right? So this is kind of exception, right? So I'll see if we have this. Yeah, if we have this, no. Okay. Oh, you know, I know where we had it. We have it right there, right? Some fibers, right? They do not synapse. They just innervate, go without synapsing to the adrenal medulla, and they stimulate cells within this adrenal medulla. And then adrenal medulla release epinephrine and norepinephrine in the bloodstream, right? So it's still part of the sympathetic division of ANS. Okay, so we're good here. Now, parasympathetic division. Now, parasympathetic division is called craniosacral division. And it includes cranial nerve 3, 7, 9, and 10. And 10 is vagus. Vagus is the main parasympathetic nerve, right? It's actually innervates almost all your internal organs, heart, lungs, and most visceral organs, right? So oculomotor 3 innervates your eye, facial innervates salivary, nasal, and lacrimal glands, glossopharyngeal, parotid salivary glands, and vagus innervates most of your visceral organs, including heart and lungs. So that's cranial outflow, and sacral outflow innervates large intestine, urinary bladder, uterus, reproductive organs, right? So now on this picture, we see parasympathetic division, right? Craniosacral. But the organs are pretty much the same. So let me just go back over here. No. Do we have this? Yeah, this picture, look. When we have both division together. So you see lungs here, heart here, stomach, pancreas. That's what dual innervation is. It means most of your organs receive innervation from both sympathetic and parasympathetic nervous system, right? You need it because, for example, your stomach, when you are resting and digesting, that what, fibers will, fire. Obviously not sympathetic, will be parasympathetic, right? So your stomach will be under control of parasympathetic division. So it will promote digestion and absorption and secretion of all these digestive juices, right? So your stomach cannot work on its own. Well, it can, it do have some intrinsic control, but your nervous system wanna, take part in the regulation. So it's do regulate activity of your digestive system, right? But it's regulating it through parasympathetic division. But when you are, let's say, saving your life, running away from, some danger, or you exercising, then your stomach activity will be inhibited. Then it will be inhibited through the sympathetic division, right? That's what a dual innervation, or your bladder, right? When you, relaxing, you can go and, urinate, but when you're under a dangerous situation, it's not time to think about going to the, restroom. All right, so that will be inhibited through sympathetic. Okay, so where we at? Right, oops. So here's, right, so here's our craniosacral or parasympathetic. Okay, I don't know why my, sorry, I think my computer is not charging here. Let me, okay. So here's our parasympathetic division here. Visceral reflexes. Visceral reflexes also have arc and have the same components as somatic reflexes. Main difference is a visceral reflex arc has 2 neurons in the motor pathway. Right, that's our motor visceral reflexes. Now, when we're talking about sensory information or visceral pain, that is sensory information, it travels along the same pathway as somatic fibers, contributing to the phenomenon of referred pain. We will look at it in a moment. But let's look at this visceral arc first. So we already covered somatic arc, right? So it's all start with the sensory receptor, but now sensory receptor in viscera. Now here we have sensory neuron, right, that sends this information to the spinal cord. And spinal cord over here is integration center. So it may be preganglionic neuron, right? So that's our synapses with preganglionic neuron, shown here in the brown. Or it can be interneuron in between them, right? It's not shown over here, but it says it can be interneuron. Or this synapse integration center can be even in the walls of gastrointestinal tract. Doesn't necessarily need to be in the spinal cord. But the big difference is now we have one motor neuron and second motor neuron. So efferent pathway include 2 neuron chain, preganglionic neuron and ganglionic neuron, and then visceral effector organs that are smooth muscle, cardiac muscles, and glands, and then we have response. Now, what is referred pain? That's what we over here. You see visceral pain travels, right? So we're gonna discuss this little paragraph here. So visceral pain efferents travel along the same pathway as somatic pain fibers. And a pain stimuli arising in the viscera are perceived as somatic in origin. Let's go look at the next slide and then we get back to this picture. So look, let's say pain is coming from the heart, right? So here's this sensory neuron, visceral sensory neuron, right? So it going toward your spinal cord, right? But look, it enters the same dorsal root ganglion and then it synapses with the same sensory neuron that, you know, that's a second order neuron that takes information to your brain. And pain coming from your skin, right? So here's our somatic sensory neuron, right? It goes the same pathway and can even synapse with the same second order neuron. So obviously your brain can be confused. Is the pain coming from heart or from the skin? Because here when they synapses to the same neuron and have the same pathway up to the thalamus, right? That might be a little bit confusion for your brain. That's what referred pain is. That means if pain coming from the heart, right, like ischemia, actually the patient can feel it like it's coming from the skin and even skin of the arm, of the left arm, right? Or it's coming from liver, like the liver is right here, but it feels like it's coming from this area of the shoulder. And that's because the visceral and somatic sensory neurons, right, they follow the similar path to your brain. That's what referred pain is. Now, neurotransmitters. Okay, so neurons release neurotransmitters, right? So let me see where I have picture over here. Okay, so let's look at the picture over here. Okay, so what do we have? We have here autonomic nervous system only, right? So we have sympathetic and parasympathetic. So here's our neuron, right? And this neuron releases acetylcholine. Now this neuron, right, in the parasympathetic nervous system also releases acetylcholine, right? This releases acetylcholine and this releases acetylcholine. Now this neuron, right, this, well, I would say this axon, right, those fibers, they called cholinergic fibers. Cholinergic fibers because they release acetylcholine. So it's right there. Cholinergic fibers. They release neurotransmitter acetylcholine, right? So now what fiber is that? This is cholinergic fiber because it's released acetylcholine. What fiber is that? Cholinergic fiber. It's released acetylcholine. What fiber is this? Cholinergic fiber, right? Now this neuron, right, it releases norepinephrine. This neuron releases acetylcholine again. So this fiber is cholinergic fiber again, and this fiber is adrenergic fiber. That's the difference, right? So now let's read. Cholinergic fiber release neurotransmitter acetylcholine. Adrenergic fibers release neurotransmitter norepinephrine. Now, most fibers are cholinergic, right? So it's all ANS preganglionic axons and all parasympathetic postganglionic axons. And adrenergic fibers, most sympathetic postganglionic axons, with some exception. Let's say at sweat glands, acetylcholine is still released. And some blood vessel and skeletal muscle. But most of the time, if you look over here, right, this is our preganglionic, right, neuron and axons. So they release acetylcholine. So they have cholinergic fibers. Now this is also cholinergic fibers. So the only adrenergic fibers are the fibers of sympathetic nervous systems that innervate their effector organs and release norepinephrine. All right, so what else over here? Now, if we have release of acetylcholine, we must have acetylcholine receptors, right? So we have two types of receptors for acetylcholine, nicotinic and muscarinic. And they're named after drugs that bind to them and mimic acetylcholine effects, right? So acetylcholine is released. If it's released, it must have its own receptors. So it must be acetylcholine receptors. There is two types, nicotinic and muscarinic. Now, nicotinic receptors pretty much, let's look at muscarinic. Let's see. I just want to see if we have picture over here. somewhere I think I have a picture. Yeah, right there. So look. So here's our sympathetic and parasympathetic nervous system. Now this is, this neuron releases acetylcholine, right? This releases acetylcholine. Now, if this neuron releases acetylcholine, this neuron must have receptor for acetylcholine. And this is nicotinic, and this is nicotinic, right? And the muscarinic is found on the effector organs. Right, so let's read. So makes sense so far, right? So we have two types of receptors for acetylcholine, nicotinic and muscarinic. Now, nicotinic, they found on the skeletal muscles and all ganglionic neurons, both sympathetic and parasympathetic, and also in adrenal medulla. Effect of acetylcholine at nicotinic receptors always stimulatory, right? Now, muscarinic receptors found on all effector cells stimulated by postganglionic cholinergic fibers. So postganglionic cholinergic fibers, all muscarinic. An effect can be either inhibitory or excitatory, depends on the receptor type of the target organ, right? So that's what it's shown over here. So this is our preganglionic neurons, right? So all preganglionic neurons that has, it says over here, okay, hold on a second. No. I'm just trying to say how. Okay. So what fiber is that, right? This is cholinergic fiber, right? Let me just show myself. Okay, so you guys have some of you over here. So this fiber is cholinergic fiber, right? This fiber is cholinergic fiber. Why it's cholinergic fiber? Because it's released acetylcholine. And those neurons are preganglionic. Now this, wait, I'm sorry. Now this neuron is postganglionic. This neuron is postganglionic, right? So they have receptors. So all postganglionic neurons have nicotinic receptors. Did you hear it or not? It's my mama's calling me over Skype. Now this postganglionic neuron innervates the effector organs, right? And all those effector organs have muscarinic receptors, right? In a parasympathetic nervous system. Not in the sympathetic, because in the sympathetic, this fiber is not cholinergic. It's adrenergic fiber because it's released norepinephrine, right? So that's what it says over here. So again, nicotinic receptors found on all skeletal muscle cells. All ganglionic neurons, sympathetic and parasympathetic, and also an adrenal medulla, and effect always stimulatory. All muscarinic receptors found on all effector cells that stimulated by cholinergic fibers. And cholinergic fibers stimulate what? It's in the parasympathetic nervous system, because in the sympathetic, we have adrenergic fibers. And then effect of acetylcholine at muscarinic receptor can be either inhibitory or excitatory. So next, we have adrenergic receptors. Adrenergic receptors for norepinephrine, right? Cholinergic receptors for acetylcholine, adrenergic receptor for norepinephrine. And we have two types, alpha and beta. And alpha has subtypes, alpha 1, alpha 2, and beta has beta 1, beta 2, beta 3. And effect of norepinephrine depends on what type of receptor is found predominantly on a target organ, right? So here, sympathetic nervous system, when you under stress, you want to release norepinephrine. It's like epinephrine, right? You want to release norepinephrine, but what neuron releases norepinephrine? Ganglionic neuron, postganglionic fibers, right? In a parasympathetic, you have nothing by acetylcholine release in a parasympathetic. Only acetylcholine and two types of receptors, nicotinic and muscarinic. In a sympathetic, on the effector organs, right? Effector organs are actually respond to norepinephrine, and it can be alpha or beta receptor. Right now over here, look, so we have, so here's the mnemonic A, B, C, and D, right? And A stands for alpha, and B for beta, and C for constrict, and D for dilate, right? So constrict and dilate. And you also put like alpha 1, beta 2. So 1, 2, alpha, beta, 1, 2, C, and D, A, B, C, D. Now, this is how you remember how norepinephrine affects smooth muscle in the blood, all smooth muscle, not only in the blood vessels, in your gastrointestinal tract, in your urinary bladder, your smooth muscle. Now, if we have alpha 1 receptor, that norepinephrine will constrict, contract and constrict. If you have beta 2 receptor, then its effect will be dilation, right? So it will be inhibitory. So smooth muscles will relax and blood vessels will dilate, right? Or, you know, let's say if it's in a stomach, right? So then it will inhibit the your work of the stomach, right? So this is really it's not an easy, all right? So I'm trying kind of make sure you guys understand that. So for example, if we have, right, if we have sympathetic nervous system, right, over here, if we have sympathetic nervous system in both sympathetic and parasympathetic, and we're talking about motor system, we have two motor neurons, and this ganglionic neuron, if it's in a parasympathetic nervous system, and it's gonna release acetylcholine. If it's in sympathetic nervous system, it's gonna release norepinephrine. Now, for example, you're running for your life, right? So you're running for your life. You have blood vessels everywhere in your body. You have your blood vessels in your skeletal muscles, and you have blood vessels in your stomach, right? You have blood vessels in your urinary bladder. You have blood vessels going to your liver. You have blood vessels going to your heart. You have blood vessels, so it's everywhere. Now, when I'm running for my life, right, my sympathetic nervous system release norepinephrine. Now, this norepinephrine, it's like very smart chemical. What it's gonna do, it's gonna dilate blood vessels in my skeletal muscles. At the same time, it's gonna constrict blood vessels that go into my stomach. So how it is possible that the same chemical will dilate some blood vessels and constrict other blood vessels? How is it possible? How this chemical knows? But it's not because of norepinephrine, it's about different receptors. So in my skeletal muscles, what receptors I would have? Beta 2 receptors, right? Because I need to dilate those blood vessels predominantly. Now in my stomach, when norepinephrine is released, what kind of receptors I will have? Alpha 1 receptor. And then those blood vessels will constrict, right? So this is only about smooth muscles. Now, if you asking, okay, how about then beta 1, right? So beta 1 predominantly found on the heart, right? So mostly in the heart. and it will increase heart rate. All right, so that's beta 1. Beta 2 in adipose tissue. Now alpha 2 is pretty much kind of like in the pancreas, blood platelets, so they are not that common. The most common receptor is alpha 1, beta 2, and beta 1, right? So alpha 1, beta 2 in the smooth muscles and beta 1 in the heart. So that's our adrenergic receptors. Now, effect of drugs. So that's how drugs work. So let's see, let me close this. Let's say atropine. Atropine blocks muscarinic receptors, and it's used to prevent salivation during surgery, dilate pupils for examination. So when we understand how those receptors work, and we understand what chemical can either activate or block those receptors, we can use it in our advantage. We can use it in the medicine, right? So we can, for example, block those muscarinic receptors, or we can stimulate them. Over-the-counter drugs for cold, allergies, nasal congestion, they stimulate alpha adrenergic receptors. We have a whole group of medication called beta blockers, and they attach to beta 2 receptors, and they dilate lungs, bronchioles in asthmatics and other uses. Because if you go back over here, remember beta 2, it's dilate, right? So if we activate these beta 2 receptors, we can dilate any structure that has smooth muscles, right? Let's say bronchioles, they have smooth muscles. Activate beta 2 receptors, dilate those bronchioles. Okay, what else we have? So here you can pretty much read about some other examples here. Now, interaction of the autonomic division. Most visceral organs have dual innervation, right? We already mentioned it, but effect is opposite. So for example, sympathetic division increases heart rate, respiratory rates, inhibits digestion and elimination. Parasympathetic decreases heart rate, respiratory rate, allow for digestion and discarding of waste. So they antagonistic to each other. Some organs, however, do not have dual innervation. For example, blood vessels. And this is called a tone. Like blood vessels, they have sympathetic tone. That means your blood vessels are activated by sympathetic division. So it's not like when you need to dilate, then sympathetic, when you need to constrict is parasympathetic, or vice versa. It just sympathetic division regulates both constriction and dilation. And it's called a vasomotor tone. So how it happens, like, look, so here's the, smooth muscles in the blood vessels, right? Because it's sympathetic division, it's gonna release norepinephrine. Now, depends on if we increase the stimulus, right? Then we constrict the blood vessels. We decrease the stimulus and tone, then blood vessels dilate. So blood vessels are regulated by sympathetic division. So it says over here, sympathetic fibers fire more rapidly to constrict blood vessels and cause blood pressure to rise, because when blood vessels constricted, blood pressure goes up. Sympathetic fibers fire less rapidly. So both are sympathetic fibers, but when they fire less rapidly, they promote dilation and decrease of blood pressure. Now, alpha blocker drugs interfere with vasomotor fibers and used to treat hypertension. So again, we can use these alpha blocker drugs. Now, parasympathetic tone. So that was sympathetic tone, right? The tone of your blood vessels. You do have some organs that mostly regulated by parasympathetic system. Then they have parasympathetic tone. And this is actually your heart. So your heart predominantly controlled by parasympathetic division. And also, okay, also some, they dominate in the digestive and urinary tract organs, parasympathetic tone. However, sympathetic division can always override parasympathetic during stress. So, right, so at normal activity, like we will talk about these pacemaker cells and how they fire, more rapidly than your 75 beats per minute. So let's say they fire like 85 action potential, right? But your heart's only beats 75 beats per minute because this parasympathetic division slow down your heart rate during your normal activities. Okay, now cooperative effect. When they both work together, sympathetic and parasympathetic division, that's called cooperative effect. And the best example is control of external genitalia, like parasympathetic fibers cause vasodilation and responsible for erection of the penis or clitoris, and sympathetic fibers cause ejaculation of semen in males and reflex contraction of a female's vagina. So for us to reproduce as species, right, we need erection and ejaculation. Now, erection is possible because of parasympathetic fibers, right? So pretty much erection happens when the person is relaxed, and ejaculation happens when we have sympathetic innervation, right? So that's how important those both systems are. So one organ, let's say our reproductive organs cannot, external genitalia, cannot function properly without this cooperative effect. Now we do have unique role of sympathetic division. We already talked about sympathetic tone of blood vessels, right? But we do have some organs that only innervated, other organs that only innervated by sympathetic division. And this will include adrenal medulla, sweat glands, erector pili muscles, kidneys, and most blood vessel receives only sympathetic fibers. So we already talked about blood vessels, right? How they are regulated by sympathetic tone, but plus adrenal medulla. And right, why do you need your adrenal medulla to be innervated by parasympathetic fibers? Adrenal medulla release adrenaline, right? Or epinephrine. Now sweat glands. Sweat glands doesn't need innervation from sympathetic nervous system because you sweating only when you're under stress. And it can be like stress because of hot temperature. It's not, it doesn't necessarily need to be some mental stress or scared for your life. But even when you relaxed, let's say you're on a beach, you relaxed, but it's so hot that your body is actually under stress. So that's why sweat glands active only when you're under stress. Erector pili muscles that erect hair on your skin, you also don't need to erect it when you're relaxed, right? And kidneys, we will talk about kidney regulation. Is very, very interesting, right? Because we have lots of mechanisms how to increase our blood pressure. That's what your kidneys do under sympathetic division. So you will retain water. Okay, so sympathetic division controls thermoregulatory responses to heat, that's sweat glands, release of renin from the kidneys, right, that's the kidneys, and metabolic effect, increased metabolic rates of the cell, raises blood glucose level, mobilize fat to use as fuels. Let me see. Okay, so almost done. Now, parasympathetic division is short-lived, highly localized control over effectors. Sympathetic division is long-lasting, body-wide effects. And sympathetic activation is long-lasting because of norepinephrine. And norepinephrine is inactivated more slowly than acetylcholine. And plus, norepinephrine and epinephrine can be released into blood not only in this chemical synapse, but into blood by your adrenal gland. And they will remain in your blood, so they will have this prolonged effect on your organs until they destroyed by liver. Now, control of ANS functioning. Hypothalamus is the main integrative center of ANS activity. Now, hypothalamic control, it may be direct or indirect through the reticular system, and we talk about reticular system. Centers of the hypothalamic control regulate heart activity and blood pressure, body temperature. This is hypothalamus regulate. Heart activity, blood pressure, body temperature, water balance, endocrine activity, emotional stage, like rage, pleasure, biological drives, hunger, thirst, sex, and also reaction to fear and fight or flight system. So that's a part of the brain that control your, integrative center for ANS, because ANS is peripheral nervous system, right? Hypothalamus is central nervous system. Okay, so that's it for chapter 14. And thank you for watching and hope it was helpful.